I'm Patrick Daly and I'm one of the team at the Rural Doctors Association of Australia. Each year, RDAA and the Australian College of Rural and Remote Medicine offer excellence awards that recognise some outstanding rural generalist doctors and some inspiring future doctors as well. I've been lucky enough to spend time chatting with a number of our award recipients for this podcast series. Today's podcast features Dr. Mandeep Kaur, RDAA's Rural Doctor in Training of the Year for 2023, and the first ever recipient of this award. Of Punjabi-Sikh heritage, Mandeep was raised on her immigrant family's vineyard in the remote New South Wales town of Hillston, nearly 700 kilometres from Sydney. After undertaking her initial medical studies in India, her family's country of origin, she returned to Australia to train as a junior doctor at Wagga Wagga Base Hospital, before moving to Sydney to commence basic physician training at St Vincent's. While her passion's cardiology, Mandeep is equally passionate about pursuing a career in rural generalism and returning to country Australia to live and work. As you'll hear, the road to rural medicine's been an adventurous one for her, detouring not only via India, but also past what could have been a career in viticulture, had it not been for some timely advice from her mum. Before we begin, I'd like to acknowledge the traditional owners of the land we meet on across Australia as we listen to this podcast. I'd also like to pay my respects to elders past, present and emerging, and welcome any Aboriginal and Torres Strait Islander listeners who may be joining us. Mandy, congratulations on receiving the inaugural RDAA Rural Doctor in Training of the Year Award for 2023. Tell me a little bit about your childhood. You were raised in a little town called Hillston and on a vineyard of all places.
Yes, great. Thanks so much for having me today, Patrick, and I'm quite honoured to receive this award. I guess a lot of thanks is to be given to the mentors and my family, especially my mother, over the past few years have really supported me through this. So I grew up in Hillston. It's a small country town in the Riverina. This was after my family had moved from Sydney, so I was quite young when I had moved to from Sydney to Hillston, and it was such an amazing experience. We loved it. My mum still is out there. We still run a vineyard. We've got an orange orchard as well. We do some seasonal vegetables or crops, depending on what the weather's like. And recently we've had some floods go through, and prior to that, we've had a lot of drought as well. So, yeah, it was been great. I've loved it. It's a small community town, and they're very welcoming. And so when we first moved there, we were, the first Punjabi family to come across, and we were welcomed, and they're very accepting of us. So yeah, we've had a lot of fun there, and grew up, doing the normal things that we thought were normal, which is riding motorbikes and helping out on the farm, driving tractors, and weekdays and weekends were mostly spent on helping my mum on the farm. It was a great place for my cousins to come, for summer holidays from the city, because they obviously had no exposure to any of this. So it was always the place to be for holidays for my family.
Absolutely.
So yeah, really enjoyed it.
What was the feeling like for you when you moved from Sydney to Hillston for the first time? Because that would have been quite a jump, I'm assuming.
Yes, it was. I remember feeling quite overwhelmed at the start, because as a child, I loved playing sport, and I carried through doing that a lot. And so the first thing I asked my mum was, "Mum, is there a soccer team here?" And
right.
I think she was very vague about the answers she was giving me. And so when we arrived, we saw how small it was, but there was a pool, and we're quite happy. My cousins still laugh at my brother and I, the fact that we can swim. Most of my cousins aren't very comfortable at swimming, and I'm very so. And so it was quite at the start. I think it took a while to get used to, but then I think the community really accepts you, and wants you to be there and be a part of this small close-knit family you end up becoming. And so I initially found it difficult because there wasn't many opportunities in like playing sports and things, but then that changed, and you become friends with lots of people, and you find different activities to do. I learned how to swim in rivers. I'm not as comfortable swimming at Bondi, but I can swim in a river no problem. It's pretty fun. So yeah, we've had a lot of good times there. Yeah.
So your family faced considerable hardship during their early years in Australia?
Yes. So yeah, my mother first migrated from Punjab in the quite earlier on, and she was relocating here, and I think facing the cultural differences as well. It was quite difficult, and then later on became a single parent, so it was quite difficult for her. And I guess the um, the implications that has on your community as a small knit community as well. So I guess she's had to overcome all those adversities earlier on. I guess once coming to the farm, I think it's been quite difficult because there was years of drought, and we had a lot of families that had to relocate, but my mum's still maintained wanting to keep the farm. And I think there's a close personal root because from back home from where we're from in India is this beautiful state of Punjab where everybody prides themselves on being these farmers, and we love agriculture. Most of your Bollywood, films that come out, and the music is all about just having this great farm life, living the experience of eating and drinking, and just living off your produce. So, my mum really wanted to keep that a part of our identity, and I think that's what we've really carried that through to life. Really, I still identify as being a Punjabi from this small country town. So, but it's been hard for her to get through floods and droughts and these mice plague and locust plagues. But yeah, she's maintained it and still is out there trying her best.
Yeah,
So
wow.
yes,
Takes
it
some
was quite
commitment, I'm
different.
sure. Mm.
Yes.
Now, there's quite an Indian Sikh community in Hillston now, I understand.
Yes, there is. So after we moved over, since then we've had there's probably about 20 other families there, and they've
Wow.
all yeah, everyone's quite close. And my mum's got this small little house there that we've converted into a Sikh temple. So every weekend you'll see my mum there cooking up some food for our local community, and everyone's always welcome there. And we have a lot of other we celebrate Diwali there, and it's just so lovely that we are able to do that in a small country town like Hillston, and how accepting our community is of that. And they're so welcoming to my mum. Like my mum, we still laugh at it, sometimes, like, "Mum, can you please not embarrass us like this? Like if an iPad stops working, it's like, I really don't know what to do. How do I fix this?" And you're trying to teach your mother how to fix all these Apple
Well, I tell you
issues.
what, she's not Robinson Crusoe there.
It's just so, but everyone in town's always really helpful and so lovely, and so I think it's just become our second family there. So yeah, it's been great.
Now, what got you interested in becoming a doctor and also into rural medicine? From your resume, it looks like wine science and viticulture was going to be your first degree at uni there for a while.
Yes. So I've got quite an interesting pathway that's led me into medicine. Initially, I really wanted to pursue like a career in viticulture and wine science, but again, um, being Punjabi, my mum being a single parent, she just thought it would be, it's like one of those typical things, right? Every Asian parent wants your child to be a doctor, and
Yes,
really wants to maintain their cultural roots. So
yes.
I guess once she realized what my pathway was leading me towards, she thought it would be best to perhaps send me to India, and so I would be amongst my community, and I'd be able to learn more about my cultural um, roots, which at the time I didn't really agree with, but I think it was the best thing for me at the time. I ended up going to a Sikh medical college, and so my family's from the north, but this was in the northeast, so it was a completely different state that I ended up studying medicine in, and it was in quite a regional and remote location. So it was very similar to being raised in Hillston, where you've got this isolated country town where the closest medical services are hours away. It was quite similar there as well. I had this medical college, but the medical college was surrounded by rice fields, and so we serviced a population that was quite disadvantaged as well. And it was a charitable hospital that was attached to it, and I was able to learn a lot of life skills there. Was able to develop learning multiple new languages as well, and communicating with the locals and understanding how the impacts of like different social determinants of health can carry through generations. And I think it was a very enlightening experience. I went from being blessed with having 24 hours electricity and running water and hot water to not being able to have those facilities, and studying with candle lights and torches at night, because there was no electricity. So it was a very unique and interesting experience. I came back a very different person, and I think my mother appreciated that a lot more. I was able to identify the importance of being able to speak your language and communicate with patients in more than just medical jargon, and just being able to explain to them the reasons why preventative medicine is such an essential part of our journey. And so it was great. It was but quite interesting how I ended up being on this path.
Yeah, absolutely. Do you think the path to India and studying medicine in India was a better move for you than going straight to an Australian university to study medicine? Because I guess it made you an Australian doctor trained overseas.
Yes, it was interesting because I think I've learned a lot of life lessons from there, and I don't take things for granted. And I think we are quite blessed to have the services we have here, and the resources that are put into our healthcare system. And I think that goes to show, after going through this pandemic, that we are very blessed to have what we do have here. And I think that if I did go straight into medicine without doing, the viticultural side of things, I don't think I would be the person I am today. And I don't think I would be so passionate about servicing my community. When I say my community, I mean just not regional, New South Wales, but also being a doctor that is of Punjabi, background and ethnicity. I think that I really learned the importance of that whilst being overseas and being a representative for my community. So yeah, I think my mother was right at the time. I think my family could attest to how displeased I was about it all. But no, I think it was the right move. I think I've really grown as an individual, I think. Yeah.
So, sometimes parents know these things, don't they?
Yes, I've been told. It's actually interesting because when I was during my high school years, my one of my mentors at that time, Mr. Mewburn, would always tell me, "Mate, you've got to stop playing sport. You've just got to really focus on studying." And all I wanted to do was play sport. And so I go back to him like, "You were right. You were definitely right, Mr. Mewburn." So we joke about it a lot.
Now, after graduating from medicine, you came back to Australia for your intern and junior medical officer years. Tell me about those years. You were first at Wagga, and you're currently at St Vincent's in Sydney, I understand.
Yes, my junior years were the best years. I absolutely loved being a junior doctor at Wagga Base Hospital. It was the best place for me. They were very accepting of who you are as an individual, and they just support you. And, I think Wagga really prides itself on its positive work environment and how they really advocate for rural health. I was so blessed to be able to work with consultants that have devoted their life to rural medicine, and they inspire every single one of us, that, not just medical students, but trainees, advanced trainees. And so I think that has really molded the person I've become and what I want to achieve as being a medical trainee from a rural, remote area, and, really advocating for that. I think that, I was really blessed to have consultant-led teaching. You go to work every day and bosses invest so much time and resources in both teaching you and making sure you're in a comfortable environment, and making sure you're in this positive working environment. And it just doesn't stop there. Like, the admin staff are so amazing, so supportive, as well as the nursing staff. Like, it takes a community to build these, hospitals. And once you work in Wagga, you just don't want to work elsewhere. And I think everyone that pretty much knows me knows how much I love Wagga, and, really advocate for everybody to at least try get a term down there and rotate through, because it's such a lovely place. And, I think we're just really lucky that I think the Riverina is quite, lucky to that we have pioneers in the field that work out of choice there and inspire so many. So yeah, I've really loved it. And from that, a lot of my consultants have worked through St. Vincent's Hospital, and so we've got this amazing network where you can pursue your future medical training at St. Vincent's Hospital. And I just remember being a junior doctor and having all these amazing registrars come through from Vinnies, and they're just, so upbeat and really want to inspire you to be the best version of yourself. And I think, it just makes being on this journey so much more worthwhile, because you just develop these relationships with them, and you see them now become consultants or doing fellowships overseas, and a lot of them want to come back and service regional New South Wales and really want to work in rural settings. And I think Wagga has really outshined in doing that, and they're providing that service to us as a community as well. So yeah, I've really enjoyed it, and I think working at Vinnie's, I feel quite privileged in how they advocate for disadvantaged communities. And I think, yeah, it's just been such an amazing experience.
So what direction do you see your career taking? What will you be doing, and where will you be in 10 years' time? I'm assuming your placement at St. Vinny's has a lot to do with that.
Yes, it has. So my most favorite terms that I've done at St. Vincent's was my cardiology term. I just loved it. I was very well supported, had amazing ATs that, really supported us. And because we've got this such close ties with the Riverina, we were able to just improve some patient care for patients being transferred from the Riverina there. So in 10 years' time, I see myself hopefully as a consultant, specialised in cardiology, but doing general medicine out probably in Griffith would be the dream. Still working and having, my little hobby farm and having my animals. If any, everyone that knows me knows I love animals. And so, I really hope that I'll be able to advocate for my community and improve and inspire, rural or local trainees to pursue a medical specialty training, and to relocate and come back to regional New South Wales and service because we all know it's in dire need of it. And I think that being able to have such a positive experience on my own journey, I hope that I'd be able to, one day also be able to inspire junior trainees to come back. And yeah.
Talking about junior trainees, you were involved during the pandemic and when you're at Wagga Base Hospital in a program looking after JMO's wellbeing during the pandemic. Tell me a little bit about that. How crucial was it during that time to support JMOs, and what sort of issues were impacting them at that stage?
Yes, so the pandemic was such an interesting part of our training. And, initially the uncertainty, I think, was quite overwhelming and unsettling for us. But I remember, there was a lot of concerns raised. We all of a sudden we were able to go from visiting our family members to being isolated, and there was working in an unvaccinated population. At that time, we didn't even really understand how our management would go, and we would see such high numbers from overseas with the level of casualties and things. It was quite distressing. I feel like everyone was quite isolated. It really impacted teaching at the time, because everyone was staying home. But I think Wagga really emphasised that teaching should continue, and we utilised Zoom teaching and team meetings, which was great at the time. I think we did as best we could, but also to make sure that everybody's well-being was kept in check. So we would have little side groups and just do fun activities virtually, and do fun games, and make sure that we always were checking in on each other. I think that was very important, because as a medical community, your peers are your main supports, and I think that once you're isolated from that, it would become quite difficult for you to share your concerns amongst your peers. But I think at that time we developed different strategies and really utilised virtual check-ins, and I think that really helped us. once, so in regional New South Wales, I think there was a relaxation of restrictions and we gathering. So, we made it a point of being able to do team bonding experiences, because most of the time, you were away from your cohort. So we utilized, our local gyms and doing exercises, which we had a lot of fun doing, and making sure we had catch ups and do, having fun activities. I remember we would host like pizza nights and Mexican nights and things. So that really helped us get through it. Yeah.
And in fact, this has been a theme of your work over the past few years, caring for junior doctors and interns. You've been involved in a number of medical trainee events, the Rural Trainee Farm Wellbeing Days, where I understand the food's pretty good, the Future Minds program. Tell me a little bit about that. It seems to be a theme of yours that you are generally interested in caring for junior doctors and interns and making sure their path through training is the best it can be.
Yes, so I think the best thing about being in Wagga is the farm trips that we all have. So most of our consultants live on these beautiful farms, which is great for catch ups and having orientations and things. So I think being a Punjabi, I think it's part of our genetics to feed people. I've been labelled as a feeder, and it comes from my mother. My mother is such an amazing cook. She prides herself on cooking and feeding. So I think part of being, you couldn't go to the Riverina and not have an amazing curry, because it's just a part of who we are. And there's a beautiful Sikh community in Griffith, as well as an Italian community there. So whenever we have new trainees and medical students come through, we definitely give them a great experience, and showcase the finest of the Riverina with our curries and our wines and our local produce. One of my consultants prides himself on making the best salami, which is debatable, but who am I to
We won't tell him
the
that.
judge of that? Yeah, we won't. But I think by creating this positive environment and allowing junior doctors to see that being in a rural setting doesn't restrict you, or you're able to have so much like fun and enjoy yourself, and there's so many activities that you are able to do. It's not like you're not going to miss out on anything. And I think by creating a positive work environment and having a cultural experience out there, you're more likely to come back. And I think that's what we've seen that if you are able to have this positive impact on trainees, they're more likely to come back. My close knit of friends, I think we just loved our time at Wagga, and we're all pursuing different specialties with the aim of coming back and servicing a community. And I think that's what our bosses have done, and they've really inspired us to continue this tradition. And so I think any way we can help out and talk about issues that obviously we all have come across. There's always concerns of like burnout, exam stress, and I think there's this taboo of speaking about these things, but I think the more we talk about it in an open, free environment where people are willing to discuss these issues and tell people of our own experiences, I think it helps break them down and allows us to access resources and be comfortable in acknowledging that these stresses occur and it's okay, and we there's ways through it.
Do you think it's easier to access wellbeing assistance in a rural setting, in your experience, as a junior medical officer or as a medical student?
Yes, I think we are, because there's a lot of trainees out there. So you've got representatives at both the junior doctor level, and then you have registrars that are always advocating for wellbeing, as well as consultants that are always willing to sit down and have a chat with you. And I think that they pride themselves on this, and they've spent years upon making a comfortable work space for you to be able to speak up and seek assistance when you do need to. And I don't think anyone has felt that has been difficult. But I do acknowledge that it is quite site dependent. Sometimes you may not be able to feel like this, but I think recently there's been a real shift in the views that we have on burnout, especially post pandemic. How this has been I think we've been quite open to this, and I think we've acknowledged that burnout does exist, and there are ways we can prevent it. And checking in with your peers, checking in with your friends. I think that would be, I think that there's a huge transition in this, which is great for medicine.
You've also been very keen to push research into medicine and surgery in rural areas. Tell me a little bit about that work, increasing rural research capacity and training opportunities.
Yeah, so a few years back, we held this the Riverina Rural Medicine and Surgical Symposium, and it showcased research that was done by the medical, surgical, general practice, and orthopedic teams. And we're quite fortunate in Wagga that a lot of our consultants are really active in doing research, and this allows a lot of opportunity for rural trainees to be involved in this from a very junior in their careers and evolve and work on this. And so we thought it would be a great idea, and so we had a lovely turnout. A lot of my friends were award winners, which was great. And I think it just shows that just because we are a rural centre doesn't mean that we don't have access to these amazing research opportunities that city hospitals do have. And our consultants, really pride themselves on advocating for us to be involved in research from a very junior level, and they make that happen for you and they mentor you through it. So it's an amazing place, and I can't speak highly enough about it.
You've also been a clinical bedside teacher, and this is a term that really intrigued me and scared me a little bit, an exam bulldog. What has teaching medical students taught you about your own medical journey?
So I think so in India it was quite different the way we were taught. Our bedside manner was very different. We had these really scary consultants. Oh my goodness, it was amazing. Like looking back at how daunting it would be, and you would have to stand up straight with your hands behind your back and look into the ground and just regurgitate things. So I think I have a very relaxed way of approaching it, just because of the my own experiences. And I think it's really important that you do it and make it as comfortable as possible. And there's no, like my boss has told me when I was a junior trainer, there's no such thing as a silly question, and you should ask as much as you can. But I think the best thing I do is you just need that one patient where you can see amazing signs and think, this is so great. I need to teach everybody about this. Everyone needs to come and see it. With Wagga has, because of obviously it's a rural hub for most of the peripheral hospitals, so you do see a lot of interesting cases there, and it's always great to take around your med students and show them these cases and do bedside teaching, because it really does help them build a foundation of their medical knowledge. The term for the exam bulldog comes from the physician's training pathway, where we go along with our trainees and assist them when they're seeing short cases. And so what we do is, as a bulldog, you are holding the magic briefcase, which has all these amazing tools in them that help us with our clinical diagnoses. So we've got tuning forks and ophthalmoscopes in there. And what
that's almost musical.
Yes, it is. And so what we do is we assist the candidate and provide them with any other equipment that they require. And what we do is, during this time, you as a bulldog are exposed to these amazing cases that are quite rare and unique at the time, and it just helps you in your learning. And you see how these cases are presented by trainees at an exam level. And I guess it just it's an inspiring process where you look up to all these trainees that later on become your friends, but just watch them perform this magic and how they examine patients and the way they present these patients to these consultants, and the discussions that are had about these presentations of these unique medical conditions. It's amazing.
So while you've been at St Vinny's, you've also developed a remote rheumatology telehealth service for the Western Murrumbidgee area. How did that come about, and what does it involve?
So yes, during my time at St Vincent's, I was very fortunate to be able to do a rheumatology term. It's one of those terms that's not offered by every major city hospital. So we're quite privileged to have that term available at St Vincent's. And it was during my first week on the term that we had a consult come through from one of the peripheral sites in the Riverina, and it was regarding a patient. And, we were personally quite moved by seeing this, the type of consults that we were getting. They were quite advanced in their condition and untreated. And so we accepted the patient, and, Vinnie's offers this service quite frequently, that, any patients that are deteriorating or quite complex, we accept and provide tertiary level care to them. And so during my time on the rotation, we noticed that we were getting more and more consult for advice, and we were more than happy to provide this service. And on discharge, I guess it's hard for the patient because the closest rheumatologist would be hours away, and there's these long waiting periods, and we understand that this is obviously having an impact on both their morbidity and their mortality, and having advanced stage disease that is untreated has long-term consequences for these patients. And so what we had started to do is, during our clinics, have some telehealth services that were provided, and this provides assistance to the patient, knowing that once they're stabilized and commenced on the appropriate treatment, they'll be able to be discharged home, but we'll be continually following them up with telehealth services. So calling in and making sure they're okay, and making sure the symptoms are well controlled, and also providing additional supports to the GPs locally, and allowing them to know that if there was any time that they needed advice and patients needed to be seen, that we're happy to see these patients and being referred to. I guess rheumatology is one of those areas of medicine that has this unmet need, and we unfortunately see a lot of conditions that are untreated that could be prevented with the long-term consequences. And I think one of the goals is for us to hopefully in the near future provide additional services, and other specialties from our hospital provide fly-in fly-out services. So hopefully the aim is, if we get funding for these positions, that we'll be able to do that in the future, and provide the Riverina with additional supports. I guess it hits home a bit differently when you're from the region and you see these conditions that can be prevented, and it's just unfortunate that we just don't have access to these specialties, subspecialties in the region. And I think that there's so much more we can do to provide these services, and I think there's so many more resources we should be trying to put in for just not my community, but all regional services, because it's, we recognise that, rheumatology has a high burden of adverse outcomes upon like cardiovascular disease as well. There's a high prevalence in the community. So yeah, we're really hoping that we can provide additional supports in the near future as well.
Now, what have been the most challenging times of your career so far, and also the most rewarding times?
So I think the most challenging part for me personally was transitioning from being a junior doctor in Wagga and then coming to Sydney and facing the Delta wave pandemic. And at the time, I remember we were out at a peripheral site on the outskirts of Sydney, and it was mainly where most of the cases were. And I think it was quite, it was a time where I think we all would just look at each other in the corridors with these plastic curtains up and zippers and trying to get through to these COVID wards. And we were, vastly unvaccinated community. I think it was quite difficult because you wanted to be supportive. You would have changes in policy all the time. And I think it was quite isolating as well, because you were fresh trainees in, a really unique setting. But I guess we all pulled through. We had each other. We had a lot of FaceTiming that we did during those times, where we would have to utilize, different platforms to help get assistance with things, because I remember at times your friend would be down the corridor and all you wanted to do was have a virtual coffee with them and be like, oh, hey, let's just FaceTime each other and see how you're doing. So it was, yeah, I think the pandemic was the most difficult part about it. I think for me personally, yeah.
And what about the most rewarding times?
The most rewarding times. I think it's the joy that my mother gets from, when I come home and tell her about all these amazing things that I've seen, or, interesting cases, or, I think that that for me is the best part about it, is that, somewhere she feels that she did make the right decision for me. And so, yeah, I think that's the most rewarding part.
What's next for you in your medical journey?
Hopefully, I will try and pursue advanced training prospects in the near future. To be honest, I really do miss going home and being amongst my family, and so I really want to. If I had the opportunity to pursue further specialist training, but do it in a regional setting, I think that would be ideal. But unfortunately, we just don't have those options with the colleges.
So you're looking at becoming a consultant specialist physician?
Yes, most definitely. Yeah. And with the aim of working back in a rural setting. Yes.
And look, outside medicine, sounds like you're enjoy some sports still, maybe a little bit of viticulture, spending some time with animals. Am I right in that assumption?
Yes, I do. I love going back to the farm. And helping my mum out. I don't do it as much as I should or could, unfortunately. But yeah, I'm a rural girl. I love the farm, and I love animals. So my friends, I notoriously known as Auntie Mandy. That's the fun auntie, and I love taking my friends' pets for walks. I claim them as my own. It's really embarrassing, actually. I'll
There's a
be
dog
the one
down
that
here in
wants to walk
Canberra
them.
if you want to walk a dog. I have one that's always happy to be taken out.
I'd love that. Yeah, I just have this special bond with animals. I don't know why. I think they think that I'm an animal as well. Like, especially lately, Rory and I, the way we play, it's just. But no, I really enjoy spending my time with animals, and I think it's because I grew up on a farm. I had lots of animals. I had pet goats, dogs, cats, peacocks. We had injured wildlife as well that we would take care of, so kangaroos. So I think I really enjoy looking after them and things. Yeah.
Well, Mandy, it's been really wonderful speaking with you today. Such an interesting journey. So congratulations again on your award, and thanks very much for joining us today.
Oh, thank you for having me. Thanks so much.
And that was Dr. Mandeep Kaur, RDAA's Rural Doctor in Training of the Year for 2023. I hope you've enjoyed this podcast, and I look forward to having you tune in again. Until next time, happy days.